Wait, I wasn't your favorite shark? Who, Mr. Wonderful?
Oh, that's it.
I'm leaving. I'm out of here.
No, dude, thanks so much for coming. I mean, it really was funny when this was coming together. And I think everybody in the audience is like, odd couple. Like, you have a Trump senior administration officer. You have a guy.
You work for Trump?
Yeah, you should probably leave.
I had no, I'm not the favorite shark. Oh my God.
You're not winning right now.
So, I mean,
Winning.
maybe Chris, like, why are we here? What is this about?
That is such a good question. I thought I was just flying in to hear this guy speak. And I'm a little sheepish to admit this, actually. A few days ago, we discovered we made a mistake at Medicare. And there was a little bit of an oversight. He knows where this is going. And we failed to enroll Mark in Medicare a couple years back. And the president won't abide that. That's just not acceptable. Medicare is really good. And I know you can buy any insurance you want, but we're really proud of Medicare. We think it's the best insurance in the world. So the president wanted me to make sure that I hand-delivered your membership card to you to put in your pocket so that you can use it going forward. Coverage begins.
Let's go, Cuban!
Today. Welcome to Medicare. We're really excited to have you. Come on, a little smile.
Thank you. Yeah,
it's actually
big smile.
amazing insurance. You're a good sport.
Moving on. Thank you, Chris.
I think it is important just to, like, before we get into like what I think is the flow of what I'd like to cover, I'd really like to start with how you two met and why this is something that's turned into a working relationship.
All right. Mark tweeted something out. I think Dave or Steve Neeleman forwarded it to me. I think I hated it, so I started DMing him mean things, and to his credit, he responded. No, actually, it was really nice. I loved what he said, and out of the cold blue yonder, I emailed you and said, "Hey, I'm running Medicare, and I saw this tweet, and I'd like to learn more." And I think you messaged within an hour, and we were on the phone the next morning, and we've had dozens of exchanges since.
Yeah.
And I think one of the things you said is like how cool Mark is like he'll get on the plane and come and like, chop it up with you and like get to the nitty of it. Like, neither of you grew up thinking you were going to be in the healthcare industry. Is that a safe statement?
Yeah.
That's a safe statement.
And let me just add, the reason I responded to Chris is because he's so smart. And I say that with all sincerity. He knows his stuff. He puts trying to help people first above all the politics. Doesn't pay any attention to that at all. And really wants to make a difference. So he deserves a big, big, big
I appreciate it. Thank you.
Yeah, and just to double down on that, like, both of you are in a situation in your lives where you don't have to work. You can do whatever the heck you want. And the idea of leaning into healthcare, which is, in my mind, a black box of corruption and, grift, like, how do you choose to go there? Like, and how do you think you can really, like, lean into this? Could you maybe talk about that? And Chris, for you, I especially like to go back to the beginning of, like, what your motivations were when you go, like, younger.
You first.
No, you first.
All right, well, my beginning on healthcare is I grew up in Idaho, the son of a doc, and I idolized my dad, and I wanted to be just like him. And so I thought I would want to be a surgeon, and I planned for that. And then when I was 13, my mom died of cancer, and it was based on a cellular mutation of an experimental treatment she had taken for rheumatoid arthritis that was triggered by my birth. And so I had a chip on my shoulder over healthcare. I was mad. I was angry about it. And so I had this devil and this angel on my shoulder pushing toward healthcare. And as is customary in the Church of Jesus Christ of Latter-day Saints, I served a 2-year mission in Romania and Moldova and had a number of experiences with the healthcare system there that was probably 40 or 50 years behind the U.S. state of care at the time. And this mission leader, this church leader, came to visit the mission. I was assigned to drive him around for a week as he visited missionaries. And he had been the CFO of B.F. Goodrich. And that was like my first exposure to business. I was the son of a small-town doc. And he said, well, you could become a doctor. He took an interest in me. You could become a doctor and you could help people, but you could also learn how to manage. And you might have more impact. You could build things. Yeah. And that resonated. And 2 of my best friends from childhood were building a healthcare company, and they were kind enough to let me saddle up with them. And Started working on that at Stanford, and off we went.
Yeah, that's dope. And your story is a little more, I would say, out of the blue.
Yeah, I mean, to go all the way back, like in 2017, when the Trump one was talking about repeal and replace for Obamacare, a bunch of people in Texas were like, "You're an entrepreneur, can you figure anything out?" So that got me into it. But it kind of went dormant for a little bit. And then I got a cold email from my now co-founder, Dr. Alex Oshmayansky, and that led to me digging into pharmacy. And it became very apparent that one of the biggest challenges in healthcare, but pharmacy specific, is that there's no transparency. And so we created Cost Plus Drugs, started shipping in January of 2022 with only 111 drugs. But the whole point was, typically if you need a prescription, your doctor says, "What pharmacy do you use?" And that's it.
I hate that question.
Yeah.
Before you've even gotten the prescription or checked the price.
What pharmacy do you use? Yeah. And so I was like, that's not the way it should be. So we created costplusdrugs.com. That's costplusdrugs.com. And when you go there, what's different is when you put in the name of the medication, if it's one of the thousands we carry, it comes up and we show you our actual cost. And then we show you our markup, which is only 15%. Which then leads to a better price in almost all cases. Thanks. Because what's really missing in healthcare today is trust. We hopefully trust our doctors, but we definitely don't trust the economics, the financial side of healthcare at all. And I'm a big believer that trust is actually an equation. Trust equals transparency divided by self-interest. The fact that we're completely transparent, and here we are 4 years later, and we're still the only pharmacy that publishes a price list of all of our medications, and we only mark it up 15%, people started trusting us. Yeah. We spent $0 on marketing or advertising, not a penny, and in those 4 years, we've served more than 3 million customers, and we just keep on growing and growing, and we've expanded into manufacturing. So we manufacture drugs that are on short supply in Dallas. We're hopefully going to be able to bring all our generics back to the United States and manufacture those. Hopefully we get some help from the FDA to do that because it's expensive to pay all their fees. And then finally, in the part that I think will end up being our true legacy, with the manufacturing pods that we created to do our manufacturing, we're now able to do N of 1 manufacturing, which is like when there's a baby who has a genetic disease and doctors and researchers are trying to come up with that one medication that'll save the baby. Now it takes months and months and months and $500,000 or more to try to make that one try. With our pods, we can put it right in the parking lot of a hospital or research center and turn that around in days for $50,000. And so we're getting ready to work on our first patient so that when somebody has a rare disease and there's 6 in the world, that's no longer a death sentence. So I think that's going to be our real legacy.
We kind of dug right into the healthcare part, but there's a whole lot of people in this room who aren't in healthcare but are builders, and I want to maybe go back to the beginning and your origin stories of like entrepreneurship. Mine was selling cookies for my mom, and she would make cookies and I'd go sell them. For the kids out here, for the young people, like take me back to 12-year-old Mark Cuban and 12-year-old Chris, and like help me get into your brain and like how you thought you could go out and do something.
Go.
As long as I could remember, I was an entrepreneur because my parents always told me if you want something, you have to earn the money for it. Neither one of my parents went to college. My mom was like 19, 20 years old when I was born. And, my dad never made more than $40,000 a year in his life. And so it was always, you have to figure it out. And one time I was 12 and I wanted a new pair of basketball shoes. I was always a basketball junkie. So my dad and his buddies were playing poker. And I would go in there and steal a donut all the time and they'd be drinking and yucking it up. And so I asked my dad for a new pair of basketball shoes. And he looked down, he goes, "Those shoes look like they work. When you have your own money and you have a job, you can go buy whatever you want." I'm like, "Dad, I'm 12 years old." And then one of his drunk buddies pops up. He goes, "I've got these garbage bags that you can sell." I'm like, "Garbage bags? Sure, I'll sell garbage bags." And he was like, "Yeah, just go door to door in the neighborhood. So that's what I did. Hi, my name is Mark. Do you use garbage bags? And once I got, that confidence that I could sell, that was it. And what I learned from that and sticks with me today, is there's no business that's ever succeeded without sales. Whatever business you're thinking about starting, you have to be able to sell. And if you're starting a business and you aren't so excited about your product or service that you want to tell everybody and that's all you want to talk about, if you aren't willing to do that, you're not going to succeed. But if you are, you can start small, in your house with those garbage bags or whatever it is, and turn it into something special.
My first job was a 3-day gig selling sloppy joes at the state fair. It was a hot tent with flies, and I just sit there for like hours serving up sloppy joes on a bun, like lunch lady style, and I hated it. And my second job was as a janitor in my dad's OBGYN office. And let's just say that's not something that a 13-year-old boy should be doing. And I quickly learned that maybe those were a couple industries that I was less interested in, and I might want to control my destiny a little more. But I didn't really get the entrepreneurial itch until a little later. So, I went to school, I was at Bain & Company for years, and I was at Bain Capital for many years. And sitting across the side of management teams, evaluating and then often purchasing their companies. And sometimes they'd be small and sometimes they'd be tens of billions of dollars. But there was a common theme in these meetings, this feeling I kept feeling, which was I was envious of them. I wanted to be on the other side of the table. Even though I loved my job and I loved my team and I learned a ton, I wanted to build. And anyone who's ever tried to solve a problem and started to see success, I think understands that spark that an entrepreneur feels. And it's addicting, and I don't think it ever goes away. The ability to see an intractable problem that the rest of the world thinks can't be solved or has not solved, and realize that you can organize talent and capital and actually have the audacity to go solve it and make it better is unbelievably addicting. And so thankfully, I had two good buddies who were doing that and welcomed me in, and then it was just game over, problem after problem after problem, which is a bit of a juxtaposition to showing up in government, but nevertheless.
And maybe a follow-up on that, Mark. You have invested in I don't know how many companies, and you've seen what works.
I don't know either, yeah.
What are the common threads and the things that people have to have, or like you've seen when they are successful? What is the personality or the team structure like? What are the commonalities across all of them?
Well, they love to sell, as I mentioned, but just as importantly, they're curious. They're always trying to learn because everything changes all the time. And when things don't change or companies don't change, that creates opportunity for somebody who's continuously learning. And then beyond that, it's just having the stick-to-itiveness, because you're going to be wrong all the time. And you have to be able to overcome that. You have to be able to recognize that competition's trying to kick your ass all the time, and you have to be willing to fight through that and realize there's no shortcuts. But if you're always learning, if you're always selling, if you're always excited, and you're always willing to continue to push forward, that's what I've seen as the common bonds. When I see companies from Shark Tank that, like, there's times on Shark Tank, and I know I'm not your favorite shark anymore, but when Mr. Wonderful will be talking and I'm just so bored.
Do you call him Mr. Wonderful?
No, I call him, you don't want to know what I call him. But I'll be so bored, I'm like, I'll just do a deal, all right, just to end the pitch. And
you'll do the deal just to end it?
Yeah, I'll do the deal just to end it. So that's where I get stuck with my worst deals, and the commonality there is they want shortcuts. They want to be on another TV show. The minute one of them says to me, okay, what TV shows can you get me on? I know I'm in trouble, because they're always looking for a silver bullet. I just have to hire this right person. If I get the right marketing person, if I bring in a president no, it's your company. You have to figure it out. So the entrepreneurs who are not willing to just do what they have to do to figure it out, those are the ones that typically fail.
Well, that's fantastic advice. Thank you I hope you're taking notes on that for all of my students out there. Chris, you've been now in government for a year. I don't think this was your plan. You were like, I'm gonna go be a government guy. But you're now in the room we had a call a few months ago, and can I say that what Trump called you before he knew your name? Okay. He called Chris the Mormon assassin. He didn't know his name, but he called him the Mormon assassin. Can you talk a little bit about inside baseball? Give us a behind the scenes of like what your life's
Yeah,
been
who
like.
did you kill?
No one. We didn't.
Oh, good.
It's true. The president likes his nicknames, and that story came because so I lead Medicare, as we've talked about, and I do a few other things outside of that. And prescription drugs prices don't just bother Mark. It turns out they really bother the president. So see, there's common ground, and he's angry about it. And he was angry about it in Trump 45, and I think he dropped prices, the prescription drug price index, by like 0.1%. It was like the first time it had gone down, and that was it. And he was really proud of it, but
wow.
Turns out not enough, and he wanted to do more. And so he dug into the issues, and interestingly, he's attacking prescription drugs from a different vantage point than Mark is. Mark's going after the middleman. Mark's eliminating all of the unnecessary steps to go straight to the consumer, and he's using sunshine as the great disinfectant to drive transparency. And that does account for a bunch of our prescription drug cost. But the president is going at it from a different perspective. He realized that we spend 3 times more in the United States than other wealthy countries do on the same drugs. Same box, same drug, same manufacturing plant, same manufacturer. And there are reasons for this. We have a competitive marketplace. Other countries buy drugs centrally. You're the United Kingdom, you have a nationalized health system. You show up to Pfizer or Lilly and say, here's the price I'll give you for your drug, take it or leave it. And by the way, they're okay leaving it and not giving that drug to their citizens. And as long as they offer a price that's just above the marginal cost of production, then usually those countries will take it. And there's a reason they'll do that, which is we fund 50% of global R&D for pharmaceuticals and about 65% of revenue and profits for the industry. And we've habituated the world to paying for this. So he was angry about this. So the president puts out a press conference on most favored nation drug pricing. And I got tasked with being one of the lead negotiators on this, going and figuring out how it was that we were going to get all these pharmaceutical manufacturers to show up and voluntarily lower their prices. And
that sounds like a really fun meeting.
I hadn't spent much time with the president, so he does this press conference, and it's right before he's going to Saudi Arabia. Remember that Middle East trip last year? And so I'm with Oz, and we go back to the Oval, and Susie, his chief of staff, is sitting there. Secret Service is outside. Marine One is fired up on the lawn, ready to take the president to Andrews Air Force Base to get on Air Force One to fly to Saudi Arabia, and the president's in the bathroom. And so he does his thing, and he comes back into the Oval, and he sees me, and he shakes my hand, and he keeps walking, but he asks a question in passing. And I answer the questions about prescription drugs, and that leads to another question. And all of a sudden, you can kind of see the schedulers freaking out, and Susie's eyes roll just a little because now everybody knows we're going to be off schedule. And he starts asking questions about prescription drugs. And in that moment, that was the most important thing he was going to do, which is a really important thing about him. He is a very present individual. The thing he is doing in the moment is the thing he is focused on. It's incredible. So anyway, Oz knew that he had these Bibles. That's the Donald Trump edition Bible, these leather-bound Bibles. And Oz, knowing that I'm religious, says, hey, Mr. President, show him one of the Bibles. Now the schedulers are really freaking out, and there's a runner in the room, and the president says, hey, go get a Bible. And so he starts to walk, and the president yells out, run! So the kid takes off, goes and gets a Bible, comes back, and he's like, here, I'll sign it for you. So he sits down at the Resolute desk, and he takes out a big Sharpie marker, and he starts drawing his name on the cover of this Bible, and he's talking to me. I'm standing right behind him. Oz is like, go stand together, I'll take a picture. Oz is amazing that way. He never fails to document an opportunity. And the president says, are you religious? And I said, yes, Mr. President. And he says, what are you? And I think, and I'm trying to decide what name I'm going to give him. And he's like, I'm Mormon, sir. And he's like, whoa, you're really religious. And so he's like, here, you'll need this. So he gives me the Bible. And then he just knew me as the Mormon. And so that was it. And he'd be checking in all the time with Secretary Kennedy or Dr. Oz or others and saying, like, how we doing on MFN? Like, literally almost daily was calling or texting on this issue. He wanted progress on prescription drug prices. And he said, well, who's working on that? And we're like, oh, the Mormon's working that, sir. And they're like, oh, good, he's a killer. So that was it. And it took a little bit until we started rolling deals out, and then I started speaking at press conferences in the Oval Office, and then he got to know me, and then we've been working on other stuff since.
No, that's fantastic. Thanks for kind of telling that story. I mean, Mark, you've been in front of Congress a few times now. You're pretty active in terms of Twitter. I tried to read all of your healthcare tweets, and it wasn't one or two. It's a few,
lot.
Thousands.
Hundreds, thousands.
Close.
As you've really dug in here, what are your big learnings as what you hope to see different, what you want to change? What is the world you're building towards in terms of healthcare?
So, Chris was just talking about most favored nation pricing and the difference between the prices in England and everything else. The one difference between all those countries and the United States, we have PBMs, pharmacy benefit managers. They don't. And those PBMs introduce all that extraneous cost that pretty much makes up the difference between the prices that they'll pay somewhere else negotiated by one entity versus here. And those PBMs, the biggest ones, own or are owned by the biggest insurance companies. And the biggest insurance companies are so big, they have 2,600, give or take, subsidiaries. That's unheard of.
That is unheard of.
They do $200 billion in intercompany transfers because they have so many affiliated companies. And the reason why that's important is, despite Chris's amazing efforts and the amazing efforts to cut drug prices 1,500%, the problem is that these big insurance companies have more control than Chris or President Trump have over prices. Because if they don't make money from the PBMs, because Chris has cracked down on them, they'll just move it somewhere else, right? So you'll see fees instead of rebates. You'll see consultants instead of primary costs. You'll see higher prices for specialty medications. You'll see, new per member per month fees so that they can then move to rebate-free offerings. They know how to game the system faster and better than we know how to respond. And I'm generally a libertarian, but the reality is you have to break these companies up. They are the AT&T of 1984, or the Bell companies of 1984. I didn't expect to hear that. The reality is they have so much control. If you made them divest all their non-insurance assets, costs would drop like a rock. And so hopefully Chris will go back, or whoever's watching in the White House, and tweet, or True Social, to Pam Bondi and say, that jerk Cuban, he thinks that we can, go figure it out, Pam, go figure it out, because if she does something, healthcare costs drop like that. Immediately.
Pam's amazing, and she is, I think, doing some pretty interesting things. That was a perfect tee-up, though, which is, and you should pull out your phones. Last night, the president launched, I have to pitch this, TrumpRx.gov. So now there are 2 sites on the internet with transparent, postable lists of prices, exactly what you're going to pay for a drug. And this is on branded pharmaceuticals versus more generic pharmaceuticals, and it's using most favored nation prices. So if you're trying to grow your family and you're struggling with fertility right now, and you go to TrumpRx.com and you want to buy the series, the cocktail of drugs to help with an IVF cycle, as of last night, your price just went down between 40 and 68% per cycle on the drug costs, based on most favored nation. We want more babies. We want bigger families. If you're on a GLP-1 right now, you were paying $500 in the cash market. If you were on commercial insurance, it was paying $800 or $900 a month. You can buy a GLP-1 pill straight from the manufacturer now for between $149 and $245. Price is trending. These are material. They will, and this is the first drop. There will be many, many more that hit as drugs integrate. Now, it's a cash pay market. It doesn't include insurance yet. This is part of the president's great healthcare plan, and he's calling on Congress to codify this for everyone who does direct-to-consumer sales, for the exact reasons that Mark is talking about. With a lot of transparency, if you want to go buy your drug as a consumer, wherever you want to buy it, find the lowest price and buy it, and then let's have it count towards your deductible and your accumulator with your insurance coverage. It'll still cover. And right now, that's not legal. It's not allowed. We want it to be the way. And so that is a core pillar of what the president's called on Congress to ratify as part of this recent plan.
Can I give you a little bit of a hard time?
Give me a hard time. We'd expect nothing less.
I know, it can't be all love fest. So on the IVF stuff, phenomenal, right? There's nothing that compares to it. But if you go to Cuban RX,
Here it is. All right. I wish we could like pull up the website.
You could.
Start having a price battle.
Because it actually just points to costplusdrugs.com.
Oh, there it is.
But of the 40 they released, there's 15 or 20 that actually have generics available to them. And so there are certain products that the branded might cost $200, which is still far less than it used to if you actually need that. But the generic equivalent might cost $6 or $10 or $12 at costplusdrugs.com. So definitely go, if you need a branded version, definitely go to Trump RX. And let me just say, we're going to be working with them. I hope. We have an API of all of our prices.
Oh, wait, what? What was
Wait,
that?
what
Could
was
you
that?
just repeat that one more time?
I hope. So I'm a supporter of Trump RX, but I just got to say, they cut costs, reduce price of brands 500%, 1,000%. Cuban RX, 1,500%.
Look, we call that Cuban math now?
Right, Cuban math.
Okay,
Cuban math.
got it.
This is fantastic. Thanks, guys, for letting us see all the ways that we can change and get better. I think one of those things that's really hot right now is around the fraud and some of the ways that people are gaming the system. Chris, we've talked a little bit about your trip to LA. Would you maybe share a little bit about what you experienced as you and Dr. Oz went there, and what's happened in Minnesota and what you're seeing now? Like, it's not just individuals. There's like an organized element to this, and I think it's important for people to understand.
Yeah, and maybe before I jump to fraud, waste, abuse, if it's okay, I can give you a little bit of a background on why I'm sitting here in this seat right now and what we're focused on as a priority. Because I think you deserve to know. You should know what we're working on and why. And this goes back to your origin story that I didn't reference previously. But this is personal, and it's personal to all of us. I'm guessing, actually I'm curious by show of hands, in the room, how many of you are in healthcare? Yeah, like some, not a lot, right? How many of you care about your health?
About your what?
Your health.
Your health, okay.
How many of you have had personally or a family member lose their health? Yeah, so you should care about this. And here are the stats. This is why this matters. This is why I begrudgingly took the job, candidly, when the transition team called in September. Right now, we have about a 65% chronic disease rate in the country. We have about a 45% polychronic, meaning people have 2 or more chronic diseases. About 30% of Americans are diabetic or emergent diabetic. About 75% of us are overweight. About 40% of us are obese. So we are objectively the least healthy we have ever been as a country. And it's actually kind of hard to be healthy. We make it difficult. This is Secretary Kennedy's MAHA agenda, Make America Healthy Again. We have 10,000 plus, I like it. We have 10,000 plus additives, emulsifiers, and dyes in our food supply. The FDA has sanctioned this. So a Medicaid mom of 2 who finishes her shift and goes out to the grocery store to pick up some food on her way home to her kids, why should she have to flip every box and look at all the things and see if it's okay? And gosh, I don't know what that is. To wonder if she's poisoning her children. Why should she have to wonder? Why is it that I have 2 kids that actually have chronic diseases? Like, we eat healthy, we've got resources. These are the questions we're asking. This is the question Secretary Kennedy is asking. Why are we so sick? And then there's the financial side of it, which is I think what spurred you into this, which is we spend about $15,000 per capita on healthcare in the United States right now. It's more than we have ever spent in our nation's history. Think about that, $15,000 per year per citizen on healthcare for the privilege of being less healthy than we have ever been as a nation. Healthcare makes up 20% of GDP. It grows twice the rate of GDP, and it is the only net negative productivity industry in the entire economy. So every dollar it grows crowds out productivity. It crowds out a better way of life. It adds no value to humanity. It sucks resources down. And so make no mistake, and by the way, it's the #1 cause of personal bankruptcy in the United States, and it will be the cause of sovereign insolvency if we don't do something about it. So anyone in here who's thinking about having kids or has grandkids should wrestle with the fact that we have inherited now a system that will objectively leave our children and our grandchildren worse off than we were. And that is morally offensive to me. It's morally offensive to the president. It's morally offensive to you. And so we can be up here and we can razz each other and we can disagree on the person that I work for, right? I support the president.
I love him.
Thank you. I want that tweeted out. I want everybody
Cuban
to
loves
tweet
Trump.
I don't hate the guy.
At Mark Cuban.
I just can find a better job for him, that's all.
Love, hey.
I truly like the guy somewhat, you know.
He's phenomenal. By the way, prescription drug prices just dropped for the first time since the Wall Street Journal's been keeping an index of prices this year.
There you go.
That's big.
Because somebody started this whole transparency thing about 4 years ago.
But I actually think that's a point. How many millions served? 3? How many people live in the country?
You know,
40
let's go there, right? First of all, let me say I love the Maha stuff, right? And because we are poisoning ourselves. There's an organization called Food Fight USA that has been very involved in trying to correct this and working with the secretary that is fixing this, right? Working to fix this and take out a lot of those ingredients. So absolutely, that's very supportive. Number 2, all against fraud, waste, and abuse, for sure. Everybody is. But you have to realize that the biggest fraud is coming from the biggest insurance companies. And the reason we're spending more than everybody else is because of how much they steal from us. And I'll give you an example. All of us that
By the way, the president agrees with you on that.
He's a smart man.
Yes, he is. I agree.
When he agrees with me. But think about how we start the whole insurance journey. The insurance companies come back to your employer typically, and they say, here's a couple plans for you to choose from. And we all make a decision, and now it's a little bit more expensive. The premiums have gone up, so maybe we choose a lower premium and a higher deductible. And typically in this country, 40% of people can't afford a $400 bill or emergency bill. So we go out there and we might have a $1,500 or $2,500, or like if we're on an ACA plan, a $5,000 deductible and a $10,000 out of pocket. What happens if you can't afford that? Effectively, if you can't afford your deductible, you don't have insurance. But here's the crazy part. If you want a loan for your small business, you can go to the SBA and there's a good chance they'll guarantee it. If you want to buy a house, you can go to FHA, and if you hit the appraisal and all that, there's a good chance they'll guarantee it. Yeah. If you want to go to Brigham Young and just party like a madman,
unlikely.
You picked the wrong school. But if you want to go to Indiana University, national champions, and celebrate.
Congratulations, by the way.
You.
That's pretty epic.
We'll lend you money to go and party and drop out after one semester. If you get into a horrific car wreck and it's going to cost you $1 million or more and you can't even afford your deductible, you're SOL, you're out of luck. And that's just wrong. There's ways for us to deal with that by guaranteeing those deductibles, but wait, there's more. Because what happens now is those hospitals want to get access to all that insurance money. So you have a $5,000 deductible. Even though you only have $100 in the bank, they will loan you money so that you can pay for your deductible so they can go and get money from the insurance companies. But now we've turned that hospital into a subprime lender. And those lendings have turned into what the multiple hundreds of billions of dollars of medical debt that people have. So that's the first place that we create this instability in our system, because it's the insurance companies that don't want you to be able to afford your deductible, because if you can't afford the deductible, they just keep your premiums. But wait, there's more. When you talk about fraud, waste, and abuse, those insurance companies negotiate with all these big hospital systems. And thanks to Trump 1 and improving with Trump 2, he deserves credit, they have to post and now post with more detail and be transparent about their costs. And when you go to look at those costs, you'll see that, let's just say it's a hip replacement. The cost for a hip replacement for this insurance company might be $25,000.
You had the numbers on this, actually. I just looked this up. We just passed regs that strengthen, under the direction of the president, price transparency for hospitals. I just plotted this out last week on a map in Manhattan.
Yep.
The range of prices for a hip replacement in Manhattan is between $2,500 and $75,000.
Yeah, it's ridiculous.
Within a 3-mile radius.
But what's even crazier is anybody with a credit card can walk in and get a cash price. That's better than what the biggest insurance companies have negotiated with those hospitals, which makes no sense. So what happens next? Well, what happens next is when you get that hip replacement and it's $75,000 is the price on the website, right? Do they pay $75,000? No. Even though it's a contracted amount.
No, that is actually the insurance price.
No, I know, no, but they don't pay that.
Crazy.
But they don't pay it though. So they'll set it up really high like this because then they can charge the employer $75,000, but they're only going to pay the hospital $50,000. So now the hospital is a subprime lender. They're underwater by $25,000 versus what they expected to get paid. So then that's not all. Now we talk about pre-authorizations. And we hear all the stories about denials. Denials are not about denying care because as they'll tell you, 98% of those get paid, right? And typically it's even higher if you go out a year. But what they do is they hold on to the money and just delay, so they get the time value of money. And then after they've paid what they do pay and they've paid it late, they go back in and audit and claw back more. So now the hospitals are getting abused and fraudulently those contracts are worth nothing and they have to hire all these administrators, all these lawyers. So that's when you see the administrative costs for healthcare going 20, 30, 40% because of the insurance companies underpaying. Yeah. And of course, when they're delaying everything because of the denials, the patients are hurt, right? The doctors have their time wasted. But because the hospitals are underpaid, clawback, subprime lenders, now they have to make up for that lost revenue. So they invent all this nonsense like facilities fees, and they'll charge more to different groups and no one gets the same price, and it's just vicious circle. So I'll say it again. The only way that vicious circle ends, oh wait.
Is Mark Cuban costplusinsurance.com?
Almost, no, better. But
better.
In any event, and I'll also add, we've heard lots of stories about how PBMs owned by the insurance companies treat independent pharmacies really, really poorly. They underpay, late pay, clawback. You know who else they treat really, really poorly other than patients? Independent physicians like your dad. They do the exact same thing to independent physicians because insurance companies are no longer insurance companies. They are companies that look for the weak link in the healthcare chain, and they push as much risk down to them as possible. So the independent physician who might have 1, 2, 3, 4 docs in their practice in a small town in rural Utah, you think it's bad when they underpay the big hospitals? You should see what they do to the small physicians. And what happens when they underpay them, claw back, late pay them, those independent physicians can't deal with it. And oh, by the way, there's a lot of administrative burden in dealing with Medicare, but you already know, you've already heard all that stuff. But all those costs become so high, they end up having to sell their businesses, right? So now you see fewer and fewer independent physicians available to anybody because of these insurance companies.
Yeah.
The only solution is to break them up. But to your point, Chris, we created a site. I'll keep on saying that to get them applause.
You might not be their favorite shark, but you're winning them over.
Right?
I think you might be coming back as a favorite shark.
But we created a site called costpluswellness.com. And what we did for my employees and my companies, we said we're not dealing with the insurance companies anymore because of all the reasons we mentioned. And we went to the hospitals and said, all those problems you have that increase your cost, we won't do those things. And in exchange, we want a discount. And we got the discount. And we said, we want one more thing. We want to be able to publish those contracts on Cost Plus Wellness so that every employer can copy what we're doing, which is leaving their health insurance companies behind because they're the devil. We don't want to deal with them at all, right? The big ones, not all, the big ones, right? And then get a third-party administrator to do all the claims, adjudication, and all that. And we're saving money, so much money at my companies, 1,500%, 2,000. We're saving so much money at our companies that you know what the deductible is for our employees that work through this program? 0. You know how much their out-of-pocket is always, including medications from Cost Plus drugs? 0. That's how much incremental cost is introduced. So how do you change all of this to get rid of the insurance companies? Really, really, really simple. If we were to take the HSAs, which they're talking about doing, right, and disconnect them from the insurance companies, because right now you have to have a high deductible.
Wait, say that last part one more time.
You guys are working on HSAs.
This is actually part of the president's plan.
Right, but where his mistake in that is, is that he wants to
You can't help yourself, kid.
No, I'm just telling you the truth. I'm just telling you the truth. You know, I'll give credit where credit is due. You've heard me say great things about Trump RX and its opportunity. But what I'm saying is, with HSAs, when you deposit money into them for people, you can't use it on insurance. There's all kinds of restrictions. But what I'm saying is, if those HSAs were disconnected from insurance, then this becomes a banking issue and not an insurance issue. So you can put as much money within whatever limits, because I know the CBO has got constraints and all that, that you set, and then you are saving your money and earning interest. And if you need health care, then that bank you've deposited in, whatever it is, they'll loan you that money. And what that bank will also do is go buy reinsurance, or hopefully the government would step in and create reinsurance, catastrophic insurance if you want, not even insurance, right? Just a reinsurance program that above, let's say $20,000, it kicks in. So now you get to save as much money as you need to for forever. And in the event you can't afford your health care, just like we do for SBA loans, for college loans, for housing loans, they'll guarantee it for you from that bank.
Yeah.
And what you've done at that point in time, particularly if you say that the money you loan can only be used for healthcare at Medicare rates, without setting price caps, you've set price caps because that's where all the money is, just like with Medicare has. And by allowing those people to go out and borrow, but it's never more than $20,000, what people forget is every penny you pay in healthcare premiums to insurance companies, you have to pay forever. You never pay it off. Even when you get to Medicare, you're still paying premiums. It is the biggest debt that you have in your life, that in terms of how long you pay it. You can pay off a house. You can pay off your student loans. You can't ever pay off your healthcare insurance premiums.
But you just hit on a point around competition. So you've posited a thesis that says we got to break up the insurers. I'm going to take the other side of that coin for the sake of interesting dialogue, which is I have 68 million people on Medicare. We have 170 million that we insure through CMS. We have 3 forms of insurance in Medicare, but I'm going to simplify for a second. We have 2 forms that we're focused on. We have Medicare Advantage, which is the insurance company. Just like you think about it, it's United, it's Humana, it's Cigna, it's a Blues plan that's insuring people. The government pays them to provide that insurance. We also directly contract with what are called accountable care organizations, hospitals, providers, and say, you just do it, go straight. We'll go straight to you. You provide the coverage, and Medicare beneficiaries go consume your care. We put a lot of strings on them right now. We have too many regulations. We make it difficult for them to compete. But what we're trying to do, what we want, is competition. We need transparency of prices. We need consumers to be able to choose. In any other market, if a consumer chooses, I want this car wash instead of that car wash, or this gas station versus that gas station, the gas station that gets chosen against goes out of business, or they lower their prices to stay into
but
business.
if you have a genetic disease, Chris, or you're in a car wreck and you're really messed up, how are you going to shop?
But we've got that sorted, right? Already you've gotten the No Surprises Act. You're not stuck with a bill.
No, that's
you
just
can
how
go
much
out
it
of
costs,
network.
right?
You don't have to worry about it.
You know,
you can go anywhere
you're
you
sitting
want.
there like this going, oh my God, somebody fix me.
You can go anywhere you want.
Yeah, but you're not in a position to make a decision and look at the alternatives.
It doesn't matter. You're guaranteed not to pay the excess cost.
No, I
Congress
guarantee
actually
you're
sorted
guaranteed,
that.
but you're not. There's no free market there when people aren't ready to be able to make a decision.
But this is the point. Right now we talk about healthcare like it's a market. And it's not.
It's not a market. That's
what is a
exactly
market?
why you break
A
them
market
up.
means a willing buyer and seller. We have that, right? Tyler provides services. You want to consume services.
Yeah, but
check.
it doesn't work that way.
But wait else? What does a market need? A market needs the buyer to know what they're buying. Do we have that in healthcare right now? Not really.
No.
And a market needs to know what the buyer's going to pay. Do we have that?
Right, but where you're
Other than with you and now with Trump RX?
No, you don't.
No. But that's the point.
Yeah, but
And
it
so
doesn't
if you
work
want
that
to
way.
actually make healthcare work, you have to drive consumer accountability, which is
That always-
core to the thesis. That's core to the plan.
You can't hold a consumer accountable when they're dying and trying to figure out how to stay alive, right?
I agree with that, but I think that's missing the mark.
No, but again, going back to what I said about insurance companies, If the insurance companies have their tentacles so far out into so many different ways, they might have pristine pricing for every single service that they cover. Drugs, service, surgeries, whatever. They're still, and you have the No Surprise Act, which is great. Congratulations. But they're still going to get you for the price of Band-Aids or whatever. They're still going to charge you outside.
This is the point.
Nobody from insurance is coming out.
You just solved the problem, and you created competition, right? So what's preventing the market from creating 500 of what you just did and putting competition on the insurers? What will they do? They will respond. They'll either get better or they'll go out of business.
Right now, it's the tax advantage that makes the difference. But your point is right. That's why we're talking about it.
That's transparency and that's competition, which is exactly what we're trying to promote.
That's what I do as an entrepreneur, is to create businesses. But what I also know, like cost plus drugs, perfect example.
Yep.
Why is it, you mentioned us for generics. Why is it we don't have every single medication already that's on Trump RX? Because the PBMs owned by those insurance companies went to the big pharma manufacturers of brands and told them literally, if you work with cost plus drugs and give them the equivalent of rebates, give them the equivalent opportunity, not even at the lowest price as all the big ones.
We won't work with you.
We won't work with you, right? Fix that, and all of a sudden, you know why they don't want the big pharma brands to work with us? Because they know that if we get anywhere near the rebates that they do, we'll show you the net price like we already do, only mark it up 15%, publish it, then just like we saw with specialty generics and now with biosimilars, every single corporation, even like public company or public government organizations and state organizations will use us as a pricing benchmark.
But that's the point. Transparency drives competition.
Right, but it's not just transparency. When you have somebody who has regulatory capture, like those big three insurance companies who own those PBMs and just say, screw the patient. Let me just tell you, those big insurance companies are too big to care. They are so big, there's no amount of competition that'll change that. I can't compete with a $200 billion company, or even bigger than that, $400 billion company, who says, you know what? Big brand manufacturer, you're going to lose tens of millions, or hundreds of millions, or $1 billion because you worked with Mark Cuban. I literally talked to the CEO of a company, and I said, of a big brand company, and I said, I did an interview like this, and I said, if the big PBMs are telling you not to work with us, smile and shake your head twice. And he was like, they would never do that. And then I went and talked to another pharma PBM and brand manufacturer, and I said, okay, how many lives do we have covered? There's 80 million out there potentially from the big three PBMs. How many do we have to have covered in order for you to sell brands to us, your brands to us? Half. Because we're going to lose too much money, Mark. We're a public company. We can't do it. So when you say it's a free market, it is not a free market when the biggest players get to say, screw these guys.
Then. And I want to pull this up because not everybody here is in healthcare, but there is a point that's relevant, and I have a call to action, which is you should be. And if you're thinking about building something, I want you to be. The government isn't going to generally solve problems. We know that. The government's role is to create an environment in which you all as insurgents, you as an insurgent, can challenge incumbents on a level playing field and solve problems. That's free market enterprise. That's free market principle.
But then
it's true. And so this is the question. You have a bunch of people. What am I doing as an entrepreneur who builds businesses, sitting running a $1.1 trillion budget for the government? This was not my hope and aspiration growing up. But this is the question. So you're sitting saying, I don't have a level playing field.
Right.
And many of you might be sitting and trying to sell business or build businesses right now and feeling like you don't have a level playing field. I had this reaction in healthcare a couple of summers ago. I was sitting there realizing, I was in a room with a bunch of entrepreneurs, and I was looking around at all my friends and realizing every single one of them was going to need to sell through to a customer that was an incumbent hospital or health system or an incumbent insurer, which meant they were going to have to bastardize their business model and their revenue model until it was acceptable to the incumbent to entrench the incumbency. And then a bit of a horrifying response, which was the only stakeholder in the entire healthcare economy of $5 trillion that didn't care about that incumbency, that only had two stakeholders, patients and taxpayers, to care about, was the US government. It could actually be the most innovative and take the most risk But you had to have people who understood entrepreneurial principles and wanted to let the free market do its
sure.
thing. So that's my question. And that's my question for you, which is bring your ideas. It's easy to sit and say, break them up. And sure, maybe that's an answer, and happened with the bells.
Think about what you said earlier. You said our healthcare costs were getting so big.
I agree.
And the debt is getting so big
Yes.
that the viability of the USA is at stake.
Yes.
So our debt is growing so fast. So then it's just a question of timing, right?
This is the point. I need you, and I need a bunch of you, and I need a bunch of you who are thinking about doing this thing to show up and actually challenge the incumbents. And what happens when an insurgent challenges an incumbent? One of two things happens. The incumbent goes out of business, or they become an insurgent themselves.
No, or they step on the competition.
No. That's cheap. Our role has to be the mandate to level the playing field. That's my point. And
so no company should ever be broken up ever.
What do you want us to do? That's an option. What else? What policies? What changes do we make to level that playing field?
Here you go. So number one.
Don't get too weedy, because not everybody is in healthcare.
Really simple. Number one, make all pricing at net. I'm going to show you how stupid the
pharmacy. Weedy. Don't go weedy.
No, I'm going to show. This is an easy example. I'm going to show you how stupid the pharmacy industry is. Right. So in any business, you come on Shark Tank and you say, I'm selling hammers. And I'm like, where do you buy your hammers? And Mr. Wonderful says, I want a royalty. But I'm like, where do you buy your hammers? And they say, we buy them from the wholesaler. And I'm like, what's your margin when you buy them? 50%. We sell the hammer for $29.95. We buy them for $15. Great. We'll see if you can sell enough. In the pharmacy business for brands, the wholesalers pay retail for their drugs. Yeah. So that brand medication that you're selling, right, you had to do all these little gamesmanship to be.
That's a policy change. Required net pricing.
There you go. But now you're stepping in.
That's what I'm talking about.
I can't compete against that at all, right? Because let me tell you what happened. If you were to change it so that, I'll use the old price of Eliquis since it's the most widely prescribed drug, and to BMS's credit, they reduced the price, and you guys had a lot to do with that. So they deserve a lot of credit for that, right? So that's great. But if the price of Eliquis was sold at the net price to the wholesaler of $300 after rebates, which is the price after rebates and fees, then the wholesaler would sell it to the pharmacy at $330. They made $330 the old way, they can make $30 again. Now the pharmacy only paid $330, so when somebody is in their deductible phase, walks in to buy Eliquis in December of 2025, the pharmacy can say, okay, I paid $330, I'll sell it to you for $340 and actually make money, as opposed to the way it is now. Believe it or not, when that pharmacy sells it at that higher $600 price, they have to get reimbursed by the big insurance companies I want to break up and their PBMs. You would think they reimburse them for their cost, and you guys are trying to change that, but they don't. They under-reimburse them, less than their cost. And so the one thing that you can do, in addition to the deductible phase like you talked about, make all pricing net. Yeah. Right?
That's the point. That's the kind of thing we can do that levels the playing field.
But it's the same thing.
It's called policy. And these are the tools that we have to work with.
You all could go on forever. And
yes, and I love talking to Chris because
there's
smart.
no doubt we could be here all day and we could go back and forth.
And everybody's like, and we're out. We're not building healthcare.
Because there's an audience of one also paying attention.
But the part I want to end with is like something that I've learned about life is that you can do well financially a lot of ways.
Yeah.
There's a whole lot of ways to make money, but this premise of doing well by doing good, and like as you think about your life right now, like how are you defining success? Like what do you look at as like your North Star in terms of who you want to be and how you live your life for both of you?
Convincing him to break up the healthcare insurance company.
I think you're going to need to go 1 or 2 pay grades above that.
No, I give Chris credit. I mean, we give each other a hard time like this even when we talk on the phone. He's smart as shit, his heart's in the right place, and he wants to do what's best for the country. And that's all you can ask for from anybody.
Appreciate it. I was doing well at Bain Capital. It was a great job. My wife was 8 months pregnant. She was finishing her graduate work. I had that envy that I told you about. And I was knocking on a seat at the partnership, and it was going well. And I remember coming home and we're doing dishes in our little kitchen in our brownstone in Boston, telling her that I wanted to leave as soon as she graduated and about a month before we were going to have our first child, because I wanted to build.
Damn.
And I wanted to go with this, my buddies, and build this company. And she asked this question that only spouses can ask. It's always the right piercing question, and said, okay, take off your investor hat or your entrepreneur hat for just a second. Put your investor hat on. Would you invest in this business? And without thinking, my mouth just ran. It vomited out. It's like, absolutely not. It's categorically uninvestable. Nobody would invest in it. It had regulatory tailwinds in our one market. We've got one product, and even if we scaled across the whole country, we'd only make about $70 million, and we probably wouldn't break even. And then my brain caught up, and I was convinced. I'm trying to stuff the words back in my mouth, and I'm convinced she's gonna say, like, no way are we gonna do this. And in an amazing testament of her support, she said, okay, I'm totally behind you. I just wanted to know. And then we went for it. I was driven.
Here's that.
There are a lot of ways to make money in life. There are a lot of ways to make money in healthcare. Don't waste your time on things that don't make the world better. Alleviate human suffering. That is an opportunity. That is a life well lived. You can make money as a shark. You can make money owning basketball teams. You can make money selling your startup. I guarantee, if you're so lucky to have a few seconds before you blast off from this life and think back to everything you did, the thing you're going to be most proud of was human suffering that you alleviated by enabling more people, more Americans, to have access
Absolutely.
to affordable health care. And that is the thing that drives me. It's why I'm in this job. It's why I don't generally see my wife and my 4 kids almost ever right now. I have never worked harder in my life. I have never sprinted faster. By the way, trying to keep up with the president who sprints faster than everybody. He's incredible. Because there's an opportunity to do the right thing. We are our brother's keeper. And there are plenty of ways to make money. Do well by doing good. That's so obvious and so easy. And I think it's in our DNA in Utah. I think it's our culture. We are a community that lifts one another. We don't compete. You know this. Look around. You see competitors in the room and you help each other. I showed up to town and I remember people who had no business spending time with me, showing up and helping me and making introductions and giving me ideas and introducing me to investors, helping our company that didn't deserve it, because that's what we do. So help one another. Do well by doing good. That's what he does.
How amazing are these two? That gets me so pumped. Thank you so much for being here. That was fantastic. Have a great day, everybody. Go Utah.
Thank you.
That was awesome.